Hi, everybody. Thank you for attending today. I just wanted to kind of go over some information about Mindwise with everyone. I appreciate you attending. In our most recent community health needs assessment, we identified mental health and substance misuse as top health priorities in Reed's service area. And we work toward addressing these needs in a variety of ways. And one significant issue related to this was the need to increase access to mental health and addiction services, because there are, quite a few barriers to people getting those services. Lack of insurance, sometimes the lack of transportation, and just basic overall stigma related to obtaining those services. So one way we wanted to try to address this was to consider a community-facing screening tool that might provide some education for folks, awareness, and maybe alleviate some of those barriers. In May, Reed Health partnered with Mindwise Innovation, and we launched our Mindwise mental health and substance misuse screening tool. This service provides 13 different screenings to anyone who may be concerned about their current behavioral health and mental well-being. These screens are free, they are anonymous, and they provide individuals with instant feedback and next steps, including links to local mental health and substance misuse providers and resources. So this is a list of the 13 different validated screening tools that you can choose from. Beside the description of that particular screening, we went ahead and listed what the tool actually is. So for those of you with a mental health background, you may recognize some of these screening tools. At this time, I actually want to take you to the website so we can go through one of the screening tools together. So let me just switch over. So when someone clicks on to take a screening, these are primarily going to be done by social media. So if someone clicks on a post to take a screening, this is actually the website they're going to go to. And I like the verbiage that's used here, so I want to go over it a little bit. It just starts out, how are you feeling? Behavioral health, which includes mental health, substance use, and more, is a key part of your overall well-being. Brief screenings are the quickest way to determine if you or someone you care about should connect with a behavioral health professional. Think of these as a checkup from your neck up. This program is completely anonymous and confidential, and immediately following the brief questionnaire, you'll see results, recommendations, and key resources. So if we scroll down, you can see they go into a little more detail about that. And then as you go a little further down, it talks about how the screenings work, and you click right here to take a screening. Then that brings us to this page that lists all the screenings that you can take. And I like that they have kind of a description with them as well. So like, for instance, concerned about my teen's mood. That would be a brief screening for adolescent depression. Afraid of weight gain, worried about eating habits. And that's an eating disorder screening. So I kind of like that it kind of leads you to which one might be the best one for you. There's also a wide range screening up here. So if someone kind of didn't really know where to start, they can take a wide range screening. And that has a few questions from a few of the key screenings. And then typically the results at the end of that might say, we might suggest that you check out the depression screening, or you may want to take the generalized anxiety screening. So it kind of guides people to another screening, perhaps. So for our purposes today, we are going to click on alcohol use screening. And so then the questions come up. You are able to take these screenings on behalf of a loved one, but it just reminds you on this screen here that if you're going to do that, you need to answer the questions, obviously, as if you are that person. So we're going to hit continue. And then the beginning here has some just basic demographic information, partnership status, and then you get into kind of the bulk of the screening. So I do want to just say up front here that I'm going to exaggerate my answers a little bit because I want you to be able to see what the feedback is that someone would receive. So, you know, no one needs to be concerned about my drinking or think that, wow, Angela really needs some help or, you know, something like that. So I'm going to go ahead and exaggerate these a little. So how often do you have a drink containing alcohol? We're going to say 2 to 3 times a week. How many drinks containing alcohol do you have on a typical day when you're drinking? So we'll say 7 or 8. How often do you have 6 or more drinks on one occasion? Say weekly. How often during the last year have you found that you were not able to stop drinking once you started? We'll say monthly. How often during the last year have you failed to do what was normally expected of you because of drinking? We'll say monthly. How often during the last year have you needed a first drink in the morning to get yourself going after a heavy drinking session? We'll say weekly. How often during the last year have you had a feeling of guilt or remorse after drinking? How often during the last year have you been unable to remember what happened the night before because of drinking? Say monthly. Have you or someone else been injured as a result of your drinking? So we'll say yes, but not in the last year. Has a relative or friend or a doctor or other healthcare worker been concerned about your drinking or suggested you cut down? So we'll say yes, but not in the last year. And then that brings us to the conclusion of the questions. And so we just hit the submit button. And then it brings up our results. So the results are your responses are consistent with alcohol abuse or dependence. And then here's kind of the feedback that people receive. So again, I like the way they word this, so we're going to go over this here. Taking this self-assessment is an important first step in your self-care. It gives you tools to recognize problems you may be experiencing and what can be helpful in addressing them. Your screening results indicate symptoms consistent with signs of alcohol dependence or abuse. Behavioral health conditions like this are treatable, and most people find that they can make positive changes in their lives with professional help and the support of family and friends. Please remember this screening is not a substitute for a clinical evaluation. Contact a healthcare professional for more information and a complete exam. Regardless of your results, seeking information can be helpful. Please refer to the available resources below. And then as we scroll down, you can see there's some national resources listed here. And if we scroll even further down, there are some local resources also. So we have Read Health here at the top. We also have the link to readhealth.org and locations that they could reach out to. We have Neighborhood Health Clinic and their locations here. We have the community mental health centers listed, Centerstone and Meridian, with their phone number and also, you know, a link directly to their website. We have 211, which is a resource line, so they can go directly to the website or call 211 to get resources. We also have listed Choices, the CERT program, and that's their emergency response team. So we have that listed as well. So if we go back up a little bit, you might have noticed there was a question here about, will you seek help? Yes or no? So we'll hit yes. And then there's also a feature here where you can have the results emailed to you, or you can print the results. So for the purposes of our demonstration today, we're going to hit print results. So you can see what that would look like. So as you can see, if we scroll down a little, here's our results right here. And then this is the information, the feedback that was provided that we went through. And then also the resources are all listed on this printout as well. So that's helpful. And then if you scroll down to the bottom, it has actually all the screening questions and how you answered them. And so we think this could be helpful because if someone takes a screening and they get this feedback and they reach out to make an appointment, to seek help for this, it would be nice to be able to take the screening questions and their answers with them, because I think it would be helpful for a provider to be able to see, oh, this is how they answer these questions. So we like that feature. So now I want to go back. So primarily, these are going to be delivered to people through social media. So this is an example of an ad that we put out, and marketing is going to put these types of ads out for us monthly. Mindwise has a toolkit that kind of coincides. They help them be timely. So like this one was for summer, as you can see. And then I know that there's one ad that has to do with gambling, and that could be released like around Super Bowl or something like that. So they do have kind of a toolkit that we can use to put out. So when someone sees this ad on social media, they can just click right on it and it will take them right to that site where they can take the screenings. This is an example of the Facebook ads that have been put out. And you can see how easy that would be for someone to, they read the ad and then just click right on take a screening to be able to check that out. So we just launched this in mid-May, and we feel pretty good about the results so far. We had 4 screenings completed in May. And then in June, we put out a press release, marketing put out a press release for us about it. And then we also partnered with WTHR for some Facebook ads to run on their social media on our behalf. And that month, we jumped from 4 screenings all the way to 311 screenings. So that was pretty exciting. And then for July, we had 446 screenings completed. So all in all, just for May, June, and July, we had 761 screenings. So we feel pretty good about that. We don't have our results yet for August. So we are hopeful that these will continue to be a good resource for folks in the community. We also think this is probably timely given the uncertainty that people have gone through recently with the COVID pandemic and just the isolation and kind of uneasiness about, how things were changing and the uncertainty of where things were going. So I think there probably are some folks that have been cooped up at home and maybe are having a little more anxiety than normal. So hopefully this could be a good tool for everyone. If you have any questions, we're happy always to answer questions. If you want to go straight to the site and check these out, you can reach the site by going to readmindwise.org. Otherwise, you can take those from our Read Communities site as well. So that would be readcommunities.org. And you can get to them that way as well. You also can, tell people to watch for these on social media if they have some interest. So if you have any questions, please feel free to reach out to Patrick or I. We're happy to answer questions about this anytime. And we hope that you find this to be valuable.